Special education within the school setting comes from the IDEA Act, which is the Individuals, Disabilities Education Act. And this act, it provides children in school settings the right to receive a free and appropriate education, which is FAPE. Every child within special education has the right to receive the same education as other students, but they may need modifications or accommodations, and that's where IDEA comes in. It allows children to be able to receive the same curriculum, but with the needs at the level that they would need it at. When a child is referred to special education, it usually sometimes will start with the teacher, but parents can also request an evaluation for their student. Students with ADHD tend to have Section 504 service plans, but if the Section 504 plan is not working for a child with ADHD, then you can request for a full individual evaluation, which is an FIE. Under special education, a committee gets formed as well. Once there is an assessment done or an evaluation done of the child, the committee will come together and the people that evaluated your child will present the results. At that point, the committee, which is composed of the special education coordinator, the teacher, the person, the diagnostician, and the parents will sit and discuss the overall results. At that point, the committee will decide whether the child meets the criteria to start an IEP. The IEP is an individual educational plan, and at that point, they'll decide that the child does qualify for special education. Once the committee has decided that the child qualifies for special education, they will identify the areas needed for growth, and the committee will come up with set goals to help the child throughout the year. The school has about 45 days to get the child evaluated. Once a child is evaluated and the results are given and the IEP is created, then the evaluation occurs every 3 years. If a child has ADHD and their academics are being impacted because of the ADHD, the school coordinator will probably give the parent a form called OHI. This is the Other Health Impairment Form. This form needs to be signed by the pediatrician saying that the patient has ADHD. And then that will qualify the child for special education. The OHI form must be completed by the pediatrician and returned to the school. I would like to emphasize to the caregivers that if an IEP is created and your child is having behavior concerns, you can request a behavior plan to be added to the IEP. As well, you can also include mental health services. So under special education, you can request speech therapy, PT therapy, and the schools will facilitate that. But you can also include your mental health services in there. So if your child is having difficulty with behaviors or having emotional issues, then your child can also see the counselor at the school, or they could bring in someone to meet with your child. And that could also be written into the individual education plan.